So I can see that most of the participants have joined. So I think we can start now. So hello everyone and welcome to this exclusive webinar. My name is Océane Vighetti. I am the export marketing manager at Deleo, which is a French manufacturer in aesthetic medicine. We are expert in body contouring devices in a non-invasive way. We have a strong presence in France, of course, but also abroad. And one of our main values is the satisfaction of our partners, from the devices to also providing with learning and knowledge. So we are currently having a lot of projects and events going on. And one of them was actually released a few weeks ago at the beginning of this year. It was a newspaper article in the Anti-Age magazine. We work closely with our key partners, and one of them is Dr. Thierry Van Hemelryck. That is a plastic surgeon and cosmetic doctor. He's using cryolipolysis technique for more than 10 years now, but was originally more into surgical treatments. So that is why the idea of this article was born. We thought that it could be interesting to share his experience on a hot topic that is CRYO versus LIPO. The webinar will last about 1 hour. You'll be able to share your questions on the discussion just below, but also on a specific Q&A box that is also below. The questions will be answered at the end. I will read the question and the doctor will answer them. So thank you again for your time, doctor, thank you. And thank you for all being connected to this webinar. We hope you will enjoy and learn. And now I will let Dr. Van Hemelryck start its webinar.
Hello and welcome to all of you. It's nice to meet you all. I am honored to be part of this webinar invited by Deleo, as my practice in liposuction and cryolipolysis is now for 10 to 12 years. So our subject is about CRYO or LIPO. One could think that the two technologies are completely opposite, but it's not the truth. So I will explain why. So first, I will talk about me. I was trained in Bordeaux, Lyon, Tours, and today, as I was president of the French Society of Aesthetic and Plastic Surgery, I am an international speaker in numerous congresses. I am former member of the Medical Council in Vendée and in main scientific society, the French Society of Reconstructive Surgery, the SOFSEP, of course, and ISAPS, International Society of Plastic Surgery. So, as I told you, I was president in 2021. Normally, it's only 1 year, but according to COVID, I had to add 1 year in my presidency. So, I organized the Congress in June 2020, but it was postponed in September 2021. The main topic was about disruption. What does it mean? We have known some disruption in our practice. First, it was the incoming of the aesthetic medicine, the cosmetic medicine, that has really changed our approach on surgery, and it's absolutely the topic of this webinar. And another point, I opened my clinic in 26. So I live very close from the ocean between Nantes and Bordeaux. I have a nice clinic with 3 areas for medical practice, well-being, and paramedical. So with a know-how and synergy of skills around 3 teams: prevention with a dietitian, anti-aging practitioner, kine, osteopath, the smile with psychotherapists, life coaching, orthodoncy, sexology, and of course aesthetic with cosmetic and plastic surgery. So in search of harmony, mind and body, the concept of La Clinique has been set for an holistic approach as an integral part of a humanistic medicine. You probably recognize the Maslow pyramid, and my object is to reach self-esteem and self-actualization for my patients. And another workhorse in my practice is epigenetic. You know the genetic code, but this genetic code has a kind of interrupters. That's the epigenetic, and this epigenetic is due to the 5 pillars that can express or not the genes. So sport, yoga and meditation, nutrition, positive social relationship, and of course have fun in every circumstances. So I had to write a paper about my practice in liposuction and cryolipolysis a few weeks ago. So you can probably read it, or you have already read it in Anti-Age magazine. About my activity, as I live in a rural department, I have still a lot of reconstructive surgery. And if we consider the ratio face and body, you can see that liposuction and fat injection, fat transfer has a great part in my activity. So in non-surgical activity, I have a lot of machines for radio frequency, cryolipolysis, of course, and lead and laser treatment with an erbium and hair removal with another laser. I used to inject hyaluronic acid, Botox. I used to inject fat and PRP, nanofat. So body contouring in fat treatment represents around 30 to 40% of my activity. So these techniques, these technologies are really important, because plastic surgery is not limited to surgery alone, because the associated surgeries such as reconstructive and cosmetic and anti-aging are also closely linked, all of which skills are covered by the plastic surgeon, who is the expert. So where are we when it comes to fat? So according to the medias, the non-invasive aesthetic treatment market size is projected to hit $150.6 billion by 2030. So it's really important to take the train now. So this growing market is due to a few points. First, the non-invasive devices the demand is growing more and more. Clients can't afford downtime. They want a short recovery. And by the way, there have been rapid advancement in aesthetic technologies that are faster, with minimal downtime, and with a very low risk. Another point is the growing interest in preventive treatment, like rejuvenation, due to the increasing desire for more natural looking results. That was one of the topics of the soft set, as the French touch sounds like a natural look, not a veiled face. Always around the market trends, the body contouring device market will have compound annual growth rates of 14% till 2027. And the keys that are driving that fact is that the growing demand for minimally or non-invasive procedures are growing up. we observe rising obesity worldwide and a growing interest in a useful and fit body. There is a wide acceptance of aesthetic procedure and increased focus on body image and appearance. And last, aging demographics of industrialized countries with higher purchasing power. If we consider the number of worldwide non-surgical procedures performed by plastic surgeons according to ISAPS data survey 2021, we noticed that the non-surgical fat reduction arrived in the 4th position after botulinum toxin, hyaluronic acid, and hair removal. So it's an activity that you don't have to miss. On this picture, you have in abscess the technology invasive on the left and non-invasive on the right, and in ordinate the efficacy. So you can see that the two important points about efficacy are liposuction on the left side and cryolipolysis on the right side. With ultrasound therapy, we have had a not a very good experience with Ultra Shape in the 2010. I had tested this machine, but it was not really perfect. Today, it is associated with the cryolipolysis with very nice results. You can see the other point, injection, that is invasive, of course, and non-invasive, electromagnetic stimulation, radiofrequency, laser lipolysis, and red light therapy. So why cryolipolysis is still ahead of the game? For 3 points: experience, satisfaction, and personalization. Experience, I have almost 14 years of existence, but Deleo company has 14 years. There have been hundreds of studies made with millions of treatments performed worldwide. And in 2022, some technological improvement. The satisfaction, it's always the best solution to eliminate fatty deposits and the best alternative to liposuction. And the rate of satisfaction is uncompared, with an average of 30% of fat reduction per session. The new generation device of Crystal Pro is today allowing a better patient care with personalized treatments and avoiding side effects. So it's a global and adapted process to help each patient maintain their youth and wellness. So what does cryolipolysis technology bring to my clinic? First, efficacy. So it's the most efficient non-invasive technique. You can have multiple treatments area from very small to large, and the treatments are going faster. Now you can treat a patient from 30 minutes to 1 hour for 4 areas in the same at the same time. It is safe, clinically proven, with no anesthesia, no pain, no downtime, very short recovery, and very, very low risk rate. And it increases your business because you attract more people, and especially younger, for the element I have told previously. It's a completely delegable activity, so you don't have to work more. Your nurse can do the job. It's not really difficult. And about profitability, in my clinic, it's about 400 euros per area per treatment. how it all started about cryolipolysis. So the first study was held in Harvard University. They noticed that children who were eating a lot of ice cream had a decrease in thickness of the cheeks, and it was the same for the patient, the horseman, in the inner side of the thigh. So that's the name of this pathology is called panniculitis, described by Duncan, Rutman, Epstein, and Oren and Beecham. And it was for some company like Deleo to it was easy to design, so to decrease temperature with a Peltier cooling system, with an assessment of the temperature, not to be too cold, and to produce pressure by a vacuum. In this histologic picture, you can see that we can notice an apoptosis of the adipocytes at 1 month. On the contrary, liposuction, the first attempt was done in 1921 by Dr. Dujarrier in a dancer woman who had a lot of fatty tissues in her legs, and he tried to remove the fat, but a gangrene occurs and he had to carry out an amputation. So it was not a good experience. Then in the 70s, the Dr. Ilius, who was previously a gynecologist, performed one aspiration of a lipoma, and he was inspired for that by a curettage for abortion. So then the wet technique with prior infiltration increased a lot the results. In 1975, Arpad and Giorgio Fischer, a cosmetic surgeon in Switzerland, developed the modern technique of liposuction with a blunt hollow cannula attached to a suction source and crisscross suctioning. Today, in most of the case, we use assisted liposuction because it's the rule for best outcomes. In my clinic, I use the microair, which seems to be the best way to remove fat tissue. So I have 28 years of experience with liposuction. I was CoolSculpting customer since 2012, and I changed in 2016 for Crystal, so Deleo company, because it was a problem of consumables who were really expensive for CoolSculpting. And it's quite different for Crystal. And I updated my machine with Crystal Pro in 2019. You can see there a newsletter I wrote in 2014 to explain what I was doing about my CoolSculpting. So in which case will I use cryolipolysis? First, treatment for stubborn fat in patients who are refusing surgery. It's more and more frequent, and it's a way to target younger patient population. The second point is addressing the treatment of areas that are too small to treat with lipo. And another point which is really important as a complementary treatment to lipo for the treatment of remaining small areas. And the last point, which is very rare, but which is really easy for a plastic surgeon, is when occurs paradoxal hypoplasia. I have had one case in 2012 with sculpting, no one with crystal, and the patient develops an increasing fat tissue. So the only treatment is liposuction. So it's quite easy to treat this problem. So here you can see some patients I have treated with cryolipolysis. This patient could have had liposuction, but she didn't want any surgery. So she has had one treatment about 4 areas in periumbilicus and 1 treatment on the hips, each side. You can see on this 3/4 view with no loss of weight. Another case for saddlebags. You can see the result is very interesting. Another patient who was refusing surgery. So in one treatment, you can reach this outcome. Another case in a man, you can see he has had one treatment, 2 areas on each hips with a very good results. And you can notice that there is also a skin retraction. That is very interesting. Another case, so it was after liposuction, so as a complementary treatment for treatment of remaining small area deposit. So it was difficult to say to the patient, you have to go to the operating room for a new liposuction. So it's very interesting to treat this kind of patient with only cryolipolysis with, you can see, a good results, very good results with skin retraction too. A 3/4 view. So that's another case about cryolipolysis on the arms. On the contrary, in which case I use liposuction when a patient fat fold is important or diffuse, with good results, of course, and it should have been longer for the patient if we had performed cryolipolysis. Another case is this patient wanted liposuction in hips. So you can see the results. I use liposuction for patients who wish high definition lipo, so to show the muscles. In this patient, it was liposuction with more radical treatment. This patient wanted only cryolipolysis, but I say to her it should be too difficult with this huge saddlebags. And yet, some patients can have very good results only with cryolipolysis. You can see this patient has had one treatment on each side with good results. In which case I use liposuction, it is when I need to re-inject, so to keep the fat and re-inject, for example, in that case, for a BBL, where I re-inject fat in the buttocks. Another case, and 3/4. So CRYO or LIPO. After what I told you and my testimonial, what do you think? You think CRYO is better than LIPO or the contrary? So we can compare some points. In cryolipolysis, fat cells are treated by freezing, and they are destroyed by aspiration in liposuction. Cryolipolysis is a non-invasive treatment, and liposuction is a surgical treatment. You need generally 1 or 2 treatments per area, and liposuction is needs basically 1 session. With cryolipolysis, you have no downtime, short recovery, no anesthesia, no scars, no incisions. With liposuction, you have downtime, basically 1 week without working at least, 1 month without physical activities, some scars, and you need to wear a panty for 3 weeks. With cryolipolysis, you can remove approximately 30% of fat in 1 treatment. And in liposuction, you are limited to 4 to 5 liters of fat in 1 treatment. With cryolipolysis, it's not really painful, and it's generally painful for liposuction in some area like hips. And the final result is at 6 months for the 2 technologies. So if you have understood what I tried to explain, it's not one or the other technique. It can be both because they are really complementary. So we are lucky to have such a tool available in our practice, because as a plastic surgeon with non-invasive devices makes us fat specialists. So you become expert in fat tissue. And moreover, when you re-inject milli, micro, and nano fat, you are really expert. You have a great expertise in fat tissue, and you become for the patient a specialist in fat tissue. So the more solutions we have, the better we can convince patients to come in our office and give them improved outcomes. So why Crystal Pro? It's really important to select right tools and right technology to achieve stubborn fat. So with a new generation of cryolipolysis technology, the Crystal Pro, we have minimized the side effects and we have optimized results. With technology inspired by ultrasound. But first, we need to select the patient. You have a great variety of treatment areas. The medical follow-up has been improved, and the quality of the applicators is now really better. The medical security has been improved with the cooling system, with the good assessment of temperature and vacuum. And the gel pads have been improved too. And some clinically based protocols have been written with good outcomes. By the way, it's improved user experience and unmatched satisfaction. So the treatments have been shortened for some of them, 4 areas in 30 minutes at less than 12 degrees. Celsius. You have personalized treatments and customized parameter selection thanks to new user interface with vacuum and temperature. So what kind of results could you expect? This kind of results. It's really impressive to my mind. I'm not sure I could have done this result with a simple liposuction. It's the same for this patient. When I saw her the first time, I proposed an abdominoplasty, but she didn't want any surgery. So I told her, okay, liposuction, no liposuction. So I treat her with cryolipolysis, and you can see the results. So the fat tissue has really decreased, and with the skin retraction, she don't need anymore an abdominoplasty. So what could we imagine as a take-home message? So you have good results if you have good selection. As a conclusion of my talk, you have an increased liposuction activity as an expert in fat tissue. Another point, very important, is that it is a delegated activity completely, so you don't have to work more. There is no seasonality as a laser, for example, and you have very rare complications. Thank you for your attention. And now feel free to ask questions. Thank you so much.
Thank you. Thank you a lot. I have some questions to ask you that I've just received. I have one regarding stretch marks and cryolipolysis. Is there a risk of getting stretch marks for patients that are repeating cryolipolysis treatments?
No, I don't think so. Stretch mark, I think it's not a good idea to perform cryolipolysis treatment in the inflammatory time of the stretch marks, but after it has no impact to my mind.
Okay, and how many sessions of cryolipolysis would you recommend in general?
It's basically 1 or 2 sessions only.
Okay, 1 to 2 sessions.
Sometimes exceptionally 3 sessions, but it's rare.
Okay, okay. I have another one regarding your preference regarding the device. Why did you prefer Crystal and Crystal Pro versus Cool Sculpting? Beside maybe the fact that it was expensive regarding
the new applicators have better shape for me. Is more secure, and as I told you, there was a problem of consumable. The business model of Cool Sculpting, I didn't agree with this model.
Okay. I have another one.
An important point that I have not seen any difference in the outcomes between Cool Sculpting and Crystal.
But you said that you had 1 case of hyperplasia with Cool Sculpting, right?
Yes. Yeah. Yes.
I have a question regarding the age. Is like a specific type of treatment you want to prefer for maybe someone that is old? Like, do you have I don't know if the fat cells are changing?
The question is, it's better for younger people. That's true. Yet in some patients who have a good skin quality, and in some areas, for example, I treat sometimes elder people in the inner side of the knees with very good results. But for elder people, as the skin has loosened the ability of retraction, we have not really good results.
Okay. Yeah, I have another question regarding paradoxical hyperplasia. Is it very common? So the answer is no, because
no, I know that the rate is approximately 0.025%. So it's very rare. I have had one case 10 years ago, and no one since that. No case since that.
And how many treatments of cryolipolysis are you making, maybe per year or per month?
Approximately two. So I calculate two patients per week. 8 fois 8 fois 4, 32. 3 fois 12, 36. Oh, I perform approximately 300 treatments per year.
Okay, that's quite a good result. I have questions regarding birth delivery. So when you're pregnant, you can't perform cryolipolysis. Are we agree on that? Maybe it depends on the area.
It depends the area, yes.
And after delivery, can you how many times can we do a cryolipolysis treatment, for instance?
I think it's the same as for surgery. I recommend to the patient 1 year after delivery.
Okay, and I have a question regarding C-section after delivery. Can we perform cryolipolysis treatments?
After, pardon?
After C-section. Because you have a big scar, so I don't know if you can.
As it is a scar, I recommend 1 year after surgery.
Okay.
It's not forbidden to perform cryolipolysis, but we have to wait that the scar is decreased and is not inflammatory.
Yeah, exactly. I have another questions regarding you. We have plenty of questions. That's quite good. We have questions regarding the results and side effects. Are they the same depending on the skin color? Like hair removal laser, for instance.
Good question. I think there are no difference. I have treated black people with the same results. So.
Okay. So that is quite good.
Yes, quite good.
I have questions regarding combination of treatments. Are you combining cryolipolysis with other treatments, or even liposuction with other treatments, such as skin tightening, for instance? Laser or toning?
I think we can associate other treatments. There's no. I don't know. I don't see why I couldn't use laser.
Because are you using in your practice, in your daily practice?
Yes. Yes.
Okay. Can we overlap the treatment in the treated areas? Is there like a timing? Is there?
Yes, of course. It's sometimes very useful to overlap treatment. As it permits to treat the fat when it's more diffuse.
Yeah, exactly. I have questions regarding also the reduction in centimeter. For the abdominal area, for instance, you have a data to share with us regarding the final reduction in centimeters for patients?
I have not here, but my nose measure the perimeter. I can't tell you how many, but you know what what makes satisfaction of the patients is, for me, that they can enter in their panties and the global shape. Centimeters, it's obvious, it's important, but my patient don't tell me about the perimeter. They told me about if they can wear the what they want and the global shape of their legs and belly.
Okay. And regarding still the cryolipolysis treatments, I have a question regarding the fat, when you remove the applicator, what about fatty lumps after the treatments? So maybe we can explain, you can explain how would you proceed when you finalize the treatment, when you remove the applicator?
So when the nurse removes the applicator, you have a kind of a bit of butter. It looks like butter. So you have to perform a massage to increase the results because it can break the interstitial tissue between adipocytes, and it increase the apoptosis of the adipocytes, and that's probably the only moment who is a little bit painful because the sensibility is coming again, and it's a bit painful, but it's not very long. It's a few minutes.
Okay. I have other questions regarding radio frequency. Can we do that 1 month after cryolipolysis?
Yes. Yes. And it can increase the skin retraction. Yes, it's very interesting.
Yeah. And by the way, I had a questions regarding the skin retraction you were talking about regarding the cryolipolysis device and the cryolipolysis technique in general. Is it due to the cold that the skin is like retracted?
Yes, it is due to cold, and sometimes this patient has had radio frequency after treatment. So yes, sometimes it's very impressive.
Okay. Do you have what's the minimum fat fold you will treat a patient? Yeah, you can measure it with the devices. You have a minimum you recommend?
Not really. Some patients have a small thickness of the fat tissue, but as they demand the treatment, so we can always increase outcomes, increase the results if the patient wants a treatment.
Okay, and I have another question regarding how to disinfect after the treatment. Do you have like specific protocols after the treatment is done?
Oh, I will call my nurse. I don't know.
You don't have any specific recommendation because you were speaking about like the cryolipolysis technique has been good because you don't have downtime, you don't have side effects. So I think there are no like specific protocols. Besides, I mean,
no. Sometimes we prescribe a cream for hydration. Yes. In France, we have Lipicar. Lipicar is a cream who can bring very good hydration of the skin.
And so you said in the previous presentation, you said you had to wait until 6 months to have the results, but you can see the results for like maybe for the two months, maybe 3 months.
Yes, you can assess the result at 3 months.
And how many times then can we do another treatment? For instance, if we treat an abdomen area in January, when can we treat it again, basically?
You have to wait minimum 3 months.
Okay.
Minimum 3 months.
So when we should expect the final result from the session? So you answered. What are the main side effects for you, or the most common?
We have very few side effects. Some colleagues have described some burns with a machine who came from Asia, I think. Sometimes we have some patients who are a bit painful, but it's not really pain. It's what we call a hyperpathy. When you touch, it's this strange sensation. So, but it's not really painful. Side effects.
From outside, we can notice maybe some redness and sensitivity, skin sensitivity, but yes, not like very
skin sensitivity. Yes. Yeah. Redness, sometimes, yes. but it
lasts like 24 hours. Yeah. For 24 hours.
Yes.
Can we expect more results with more than 3 to 6 sessions, for example? Are we able to do that much treatment, like 6 sessions of cryolipolysis?
I didn't try.
What is your maximum on one person, on the same person?
3 treatments. 3 times. Yeah.
Okay.
But we could imagine, for example, for very huge saddlebags, that we could treat the patient more than 3 times and have results.
Okay. And how many times do you combine per year, maybe, the cryolipolysis and the liposuction?
Oh, many times. I don't know. When I have insufficient results with lipo, I could say 1 or 2 patients per month. It's not not so frequent. No.
That's still that's still a number. I have a question regarding also the liposuction, because you said you are doing cryolipolysis around 300 treatments, but how many for the liposuction?
Oh, less. I treat.
So cryo is more trendy.
1 or 2 patients per week, so only, I could say, only 100 per year.
100 per year versus 300 for the cryolipolysis.
Yeah.
Okay. And I have also
for liposuction, I need to go to the operating room, so.
Yeah, it's a bit more deep and complicated.
Yes, and I have other patients for facelift and so on.
Yeah. And how many, is it frequent that you are not satisfied with the liposuction results?
It's not, I'm satisfied, and the patient too, but sometimes there is a small area where I'm not really satisfied. So cryolipolysis is there to help me to increase the satisfaction of the patient.
Okay. Yeah, I see. What is the preferred criteria of patients, or how do you select the good patients for the cryolipolysis treatment? What is your list, your to-do list of criteria?
The best patient is a person who was only localized area of fat tissue, who is rather who practice rather sports, so is relatively thin.
Mm-hmm.
So it will be a good candidate for such a treatment. If it's an obese patient, it's not an indication, and neither for liposuction too. She has to lose weight before.
Mm-hmm.
Nor liposuction, neither cryolipolysis are techniques to lose weight.
And regarding the treatment, have you ever been unsatisfied with the cryolipolysis? Do you have like unsatisfied patients? Does it happen?
Sometimes I have had patients who found that the result was not extraordinary, not impressive. So as we perform the second treatment, you increase the satisfaction.
Okay, that's true. Are there clinical pathologies that can be treated with cryolipolysis? Is it just aesthetic?
No, there's some pathology like I'm not sure of the translation in English, cryoglobulinemia.
Maybe.
And Raynaud syndrome.
Oh yeah.
The pathology who are involved in with the cold, but not really a lot of complication, contraindication.
Okay.
Porphyria, I think too. It's another pathology, rare.
Yeah. Why would you say that Crystal Pro is the best on the market? Thank you for this question.
No, I have seen.
You said it better. You said it earlier.
Yeah, yes. In fact, the security has been involved. The applicators are now more comfortable, and the time of the treatment has decreased to my mind, I don't know a machine equivalent. So course sculpting is probably a good machine, but you know, as I'm not okay with the business model, I prefer Crystal Pro.
Yeah, indeed, and I can also speak maybe more about the Crystal Pro, as you wanted some explanation on that, but it was quite interesting because you also had the old version of our Crystal, and then you went to the Crystal Pro. The Crystal Pro is the latest generation of cryolipolysis devices. So you have a lot of studies that were done by the past to release this device, but also that are going on, and that is quite good because we had limited side effects actually to optimize the results. We have a revolutionary ultrasound, so it was quite interesting to introduce that, as we are very unique on the market on that topic. It is really a scientific tool that all doctors can use to measure the fat fall just before the treatment, to ensure also the safety of the patient that is suitable for the treatment. And also just after the like 2 or 3 months, you can wait until the good results are here. You can also measure it afterward and see with the ultrasound the scientific proof of the results. So that is one of the the main point I would say regarding Crystal Pro. You have medical safety and security because you have the CCDS cooling system that is a patented system of Deleo that allows us to ensure the diffusing system in 360 degrees around the applicators. We have also a live temperature and vacuum control on the monitor, so that is also quite good. And finally, we have also improved the user experience because we have currently studies going on saying that we can treat not only 2 areas, but 4 now with our applicators, but also not in 1 hour, but in 30 minutes for a little bit colder at -12 degrees. So we are currently doing this study. We will be very happy to share the news when we will be releasing it. So that is why we can say that Crystal Pro is really an amazing device, proved by a lot of French doctors, but also internationally. So yeah.
Perfect.
I had another questions regarding what is the impact on the liver when you use 4 applicators at the same time? Even on the liver, yeah.
Well, some studies have been done a few years ago on the cholesterol and triglyceride, and there is no impact on the cholesterol and triglyceride.
Okay.
So the liver is not impacted.
So this is good. And then what are the usual recommendations for the patient before and after the treatment? Do you have any specific recommendations?
No.
Actually, it's not like liposuction, so you don't have to have a surgical, treatment. You don't have to go to anesthesia. You don't have to wait until going back to work. Actually. Yeah.
No, you can have your session in the morning and work in the afternoon. Just no impact. You are not tired. There is no impact really.
Yeah, so that is quite nice also. I have, does your nursing staff like using the Crystal Pro? Does your nurse like to use it?
Yes, I don't know. She's okay with that.
Is it easy to use?
Yes.
Is she confident with the device?
I'm just there to draw the areas, and then she's using the machine with the applicators and the massage, and no, she does all, and after treatment, I've noticed that she was still smiling. That's no problem.
That's good news. I'm just waiting if there are any more questions, and I am adding in the discussion also the email address, my email address. If you want to ask me any questions, you can. I will also let Dr. Van Hemelryck maybe answer some of them if you have still, but I can also liaise with him if you have any more questions. So if you have any questions.
And you can send me email via my website too, and follow me on Instagram if you want.
Yeah, you are very active on social media too. I have a last question for you. Is the device requiring a lot of maintenance?
No, I have 1 maintenance per year, but I have had no problem at this day. No.
Okay. And is the training complicated for your nurse or your staff?
Not really, no. No, and the Deleo company proposed some formations.
Yes, yes, we are. Okay, so I think we have answered all the questions. Yes. Yeah, I think so. So thank you all for joining this webinar. I hope you enjoyed it. Thank you also for all the questions. Very interesting discussion. I will send an email to everyone with the replay of the webinar because it is recorded. And don't hesitate to contact me. You have my email address in the discussion. If you have any questions, comments, or if you want to share your thoughts about the webinar, it would be a pleasure to discuss with you. Thank you all. Thank you, Doctor, for your time. Take care.
All of you too.
Take care and enjoy your day. Thank you. Oh, if you want to have the last word, Thierry.
Okay, thank you so much to all of you for your attention. And I can answer to your question by email too. So don't hesitate to do that. See you.
Thank you. Bye.
Bye.